Depression, also known as major depressive disorder (MDD), is a commonly seen but severe mental disorder among humans. It causes serious symptoms that affect human mood and cognitive process, can result in physical and psychological pain, and lead to memory distortion, insomnia, etc. Humans have discussed depression for a long time, and indicates three different aspects that may cause depression, which are biological, cognitive, and sociocultural approaches. Within the biological approach to depression, the neurogenesis theory of depression is considered to be more convincing than the serotonin hypothesis, as it explains a wider range of symptoms of depression such as memory distortions. The neurogenesis theory of depression argues that depression is the result of the cessation of neuron birth in the hippocampus and other neuron networks related to dopamine, serotonin, and norepinephrine. The neurogenesis theory explains memory distortions with case studies supporting the theory. Psychoactive drugs are often used by humans to resolve the symptoms of depression. They are also known as antidepressants. These antidepressants can relieve the patient of the symptoms of depression by affecting the neurotransmitters. They can even achieve no symptoms, but the patient is likely to relapse at any time, and once the medication is stopped, the symptoms will reappear. Serotonin is thought to play a key role in mood regulation. Most antidepressants aim to increase or decrease the level of serotonin. SSRIs, or selective serotonin reuptake inhibitors. This antidepressant increases the level of serotonin by stopping the reuptake of neurotransmitter when it's reabsorbed into the terminal buttons after neurotransmitter is released, and binds to the receptor site on the postsynaptic. Pratt et al. 2011 carried out a study to find out the consumption rate of antidepressants in American citizens from all ages, genders, ethnicities and nationalities, by requesting individuals to complete surveys regarding their intake of antidepressants to treat depression. The results declared that between 2005 to 2008, 11% of Americans aged 12 and over took antidepressant medication. In 2005 to 2008, antidepressants were the most common prescribed drug taken by Americans. Later in 2010, antidepressants were the second most prescribed medications, after drugs to lower the cholesterol. Geddes et al. 2003 supporting that the antidepressants drug is an effective treatment and prevents relapse. Sample. Geddes et al. 2003 investigated the efficacy of antidepressants to treat depression and prevent relapse, which refers to symptoms returning after the medication is suspended, in 4,410 patients with depressive disorders. They carried out a systemic review of 31 randomized trials with 4,410 patients and determined that antidepressants are an efficient approach to treat mental illnesses, such as depression, as well as preclude relapse. The use of drug therapies prevent suicide in depressive symptoms, as the antidepressants are agreed to be more effective than placebos for severe mood regulations. Drug therapies also show quicker and more effective results than psychological treatment, and it is often necessary for depressive patients to have drug therapies first so that the patient is able to engage in the psychological treatment. However, drug therapies can often cause serious side effects and sometimes may be misinterpreted as one of the symptoms of the disorder. Drug therapies also increase the risk of having negative effects when it used in combination with certain food or other drugs. The social and cognitive approaches need to be taken into account when giving drug therapies. Relapse rates tend to be high when patients discontinue using the drug therapies, which could be the results of failure to develop social relationship, close family bonding, or too many eliminations. Therefore, apart from biological treatments, cognitive and environmental factors need to be carefully considered when giving a treatment. Last but not least, humans' depression is a very severe mental disorder that can be caused by various factors, which should be carefully treated and considered different approaches to increase rates of successful treatment. Now let's do some